Really pleased to be able to be working with Bradford NHS to look at how they use Nature Connection as part of the way that they support the people they work with. And we were able to fund them as part of our nature recovery project in order to spend some time looking at how they could best use Nature Connection, both on the wards, on the hospital site, nearby the site, but also further afield. It's been fantastic working with Joe as he looks at all of the different ways he can use Nature Connection to support people's health.
So I'm the Green Occupational Therapist here at Bradford District Care Trust. And we've put this film together to showcase what we're doing out in nature with our service users and also our staff, and hopefully you'll get a taste of the benefits that it brings them. But also we just want to emphasise that this is just the beginning, and hopefully the project will expand to every team and area of the Trust.
Nature provides a brilliant place for people to improve their mental well-being by using it as a place to enjoy the nature that you can see, take a moment to relax, engage in conversation with people around you, or use physical activity to help improve your mental and physical well-being. At the beginning of the project, in the first week, there were some service users who were a bit too nervous to get onto the canoe or have a conversation with me. But now the project's gone on, everyone seems a lot more happier, they're talking more, and they're enjoying the canoeing a lot more.
So our programme works where we encourage people to get a real ownership of nature and to become much more connected. So to make observations and to think about senses and feelings. And we've found that with the service users, that's worked exceptionally well.
It's super relaxing, really. I'm aware it's exerting, physically exerting, but mentally relaxing.
Something that, you know, we can't provide on our own, and it's really great opportunity for people that have never canoed before and not walking regularly, and it's hopefully gonna lead them on to continuing.
It is a great way to cleanse the mind. You can, rather than sitting at home watching TV, being outside in the daylight today is more beneficial than anything else.
We have started an allotment group. So the group's been running for about 6 months. It has really sort of taken off and become a real sort of source of support in our mental health work. The group is absolutely run by the community who attend it. They decide what they want to do, they decide the activities they want to do, and it's really become like a role for people actually, that they will have a task that they'll do in the group themselves.
It helps when you meet people who have got a similar illness to yourself, so you find it easy to get on. You're getting yourself up in the morning, getting breakfast, getting dressed, coming here. You know, it might seem nothing to a lot of people, but if you've got a mental illness, it's quite it's something. You know, it's an achievement.
Yeah, develop friendships as well, and you don't feel as anxious or depressed.
I look forward to seeing the different people and sharing our experiences. It means the world to me.
I'm a volunteer that helps out with the nature group that runs on a Wednesday afternoon here at Linfield Mount. During the summer we did lots of planting of various plants and bulbs and seeds, and during the winter months we did more indoor activities, doing nature themed origami or pumpkin painting, making nature Christmas cards. I feel like it's really beneficial for the service users that engage with our activities. They seem to really enjoy it. It's really good for them to get off of the wards and wherever possible to get outside, become involved with the activities that we're running. And for me as well, I feel like it's been really helpful. I've got a history of mental health problems, and I've found that being outdoors really helps to focus your mind on something different.
We had a service user on the rehab ward,
He didn't really engage much in interventions, but when we kind of told him that we were going to start this gardening group, his care coordinator got in contact to say that he was really interested in gardening. So he came along to the group, and it was just amazing to see the difference in how he presented himself. He was really engaging, he kind of took charge, and it was just nice just to see the confidence in him and to see him doing something that he really enjoyed.
I like the gardening group because I like what they do, like painting stones and doing a bit of gardening when the sun's out and everything. So it's me something to come out and look forward to once a week. I think it's really, really good because you're nurturing something that's going to grow into something.
Okay, so the seed library is basically, it's available to anybody who uses our library. And the idea is it's a take and share principle. And the whole idea is we're trying to sort of interest people in growing food, in growing plants, in just growing generally. And this is tapping into the green therapy and the sustainability agenda of the Care Trust.
So this kind of work with service users has multiple benefits for sustainability. So one element that we're trying to test out is whether it's a sustainable model of care, so a low carbon model of care, and whether it's an opportunity to help potentially reduce medication or reduce the number of visits that patients need, thereby creating a lower carbon care pathway. But obviously it also fits in with the wider biodiversity, especially if we can plant on our sites, and helping both our trust sites and the local environment to adapt to climate change.
So Hare Hills Farm woodland is a perfect example of how people can benefit from nature and being outdoors. There's the opportunity here to enhance the landscape and enhance biodiversity levels, but also just learn about nature. And once people become that little bit more educated, that's when the connection happens, that's when the magic happens, that's when people feel that kind of stress leave their bodies, that's when people feel that they're just doing something good, rewarding. And we see people's moods lift incredibly fast when they're outdoor, working as a team and learning something new.
Nature, outdoors, nature life, seeing wildlife and nature, how it grows. I feel that I achieve something, a goal in my life.
I like being out in the outdoors because I think it gives me some peace of mind, to be aware with my thoughts and myself. I like planting, I like gardening. I don't know, it just makes me happy.
So VR in nature was a tool which we decided to adapt into our therapy activities on the ward in terms of mindfulness. So we have patients who actually enjoy taking walks out in the open but couldn't do that at the moment because they don't have leave. So with VR in nature, they're able to feel that sense of being out in the nature, being in the park, sitting on the bench, watching leaves fall, hearing the sounds of the lake and feeling that sense of nature. So this helps them with, reducing anxiety, reducing stress.
The aim of what we do with Joe and the NHS is to bring out lots and lots of groups, often from really urban areas like Keighley and Bradford, people who've never had the opportunity to come and experience the beautiful Yorkshire Dales National Park. And we help to kind of break down those barriers by offering a transport grant so that people can come out for free.
Since Joe arrived, he supported us to grow our gardening group. More people have started attending. We've got funding. We're just able to get more people here. It's been wonderful.
Just relaxing, that's all, and it's away from the environment. I'm not happy where I am at the moment. So it's nice to come around and do things and meet these people.
You can see the impact on the service users' lives. They're much happier, they're really confident. It's really great to see.
So we use it as an intervention for people, and it allows them that space in nature. It's also like a mindfulness exercise. It can help them feel more at ease. It can help them open up a little bit more with each other in this group setting.
This often spills out into their everyday life. So if, for example, in the summer, we'll harvest the fruit and the vegetables that we've grown, and then people often share recipes with each other, and then somebody might bring something the next week. So like one week we had jam and scones with homemade jam that somebody had made with the fruits that they'd harvested.
From the very beginning, I was made to feel very welcome, and I realised that there was no pressure. We could just do things in our own time and enjoy things in our own way. If you wanted to socialise with other people, that was fine. We could do that. If you wanted to be more on your own, just doing a task, that was equally fine. So the whole ambience of the place and the fact that we could socialise and relax in our own particular ways was very, very helpful indeed. So much so that I'm still here and very enthusiastic about that all carrying on.
100%. Do it.
I don't know, it just makes me happy.
I feel like I achieved something, a goal in my life.
Give me something to come out and look forward to.
It's something, it's an achievement.
You don't feel as anxious or depressed.
It means the world to me.